Good afternoon to all of you students. Today I am going to teach you the topic is myopathy for final year physiotherapy students. Myself is Dr. Vishwas and I am to teach you the topic, right? Myopathy. Now first slide. Good. Now first I am going to introduction of myopathy. This is hereditary myopathy, mostly heterogeneous group of inherited disease. Mostly in this disease, progressive muscular weakness, destruction and degeneration of muscle fiber. Yani primary degenerative disease of mostly involve the skeletal muscle. Next. Good. Myopathy, this is the definition simply. This is a muscular disease in which muscle fibers do not function for any one of the many reasons, resulting in the progressive muscular weakness. Next. Good. Now the types. First, cross-linked muscular dystrophy. The subtype of this Duchenne muscular dystrophy, Becker's muscular dystrophy and scapulohumeral muscular dystrophy. Second type is autosomal recessive muscular dystrophy. In subtype is limb girdle muscular dystrophy, scapulohumeral muscular dystrophy and congenital muscular dystrophy. Next. Third is autosomal dominant muscular dystrophy. This is facioscapulohumeral muscular dystrophy, distal muscular dystrophy and oculopharyngeal muscular dystrophy. We discuss in later. Now the common features, what are the causes? First, severe reduction in the muscle fibers. Second is because of inflammation. They include infections, muscle injury, inherited disease that affects the muscle function, and last, this is thyroid disease. Next one. Pathology, this is severe reduction in the muscle fibers because of the any abnormality in the muscle cell structure leads to the various pattern of the weakness and dysfunction. Pathology involves cardiac muscle fibers, means there is hypertrophic or dilated cardiomyopathy in later stage. Next. Now, the common age group is involved in Duchenne and Becker's because these two myopathies are common. So in Becker's muscular dystrophy, it is less severe and age group is affected 2 to 16 years, and for Duchenne muscular dystrophy the age group is 3 to 10 years. Now clinical features of myopathy, this is a general terms. So first, muscular weakness, this is mainly present Gover sign, there is difficulty from sitting to standing, mostly proximally involved. Contracture, this is severe. Pain, inflammation if present, mostly present in pseudohypertrophy in calf muscles. Deformity is present in later stage. All deep tendon reflexes are normal, diminished or sometimes absent. Tone slightly decreased or normal, and other systems like respiratory, cardiac is involved. Now this is Gover sign. There is difficulty for the sitting to the standing, for using hand to push on legs to stand. This is the stages, right? Next. Now another clinical feature, same hypertrophy of calf muscles. Early signs for falling, there is difficulty in getting up and waddling gait. Respiratory and cardiac muscles are involved. Respiratory functions become fetal, reduced deep tendon reflexes, and all the sensations are normal. Next, continue. Abnormal gait patterns, there is waddling gait. Frequent fall to the patient. Difficulty in getting up, this is Gover sign. To difficulty in straight climbing, and mostly lower limbs are more involved than upper limb. Next, continue. Another clinical features is lumbar lordosis, contracture, scoliosis, dependence for all the ideal activities like dressing, bathing, toileting, turning the bed. Calf hypertrophy is most common, muscle weakness, and lastly for the complication is the death. Next. Also to see the posture, first to see the retraction of the shoulder, weak posterior hip muscles, lumbar lordosis, hyperextension of knee, this is weak quadriceps muscle, and equinovarus, right? This is a picture of posture. Next. This is another pictures for posture, this is hyperextension, lumbar lordosis, right, involved, and hypertrophy for calf muscle. Next. Which muscles are affected most commonly in myopathy? Brachioradialis, latissimus dorsi, biceps, triceps, pectoralis major, iliopsoas, hip extensors, and rectus femoris. Next. Hypertrophy is mostly present in calf muscles and in deltoid muscles. Also involved diaphragm, intraocular and facial muscles are in later stage or rarely involved. Now, associated problems with myopathy, this is first IQ, mild mental retardation, skeletal deformity and contracture, weakness and scoliosis are present. Now, nutritional problems is associated with myopathy. This is obesity, malnutrition, pressure sores, and an infection in the lung. Now, also bowel problem is constipation, bladder incontinence, and uncontrolled vomiting and other symptoms. Now, investigations for the laboratory: complete blood count, lung function test, erythrocyte sedimentation rate is high in inflammatory region. CK level, this is other raised. Genetical study, this is to see the location, types of the chromosomal abnormality. This is more important is. Now, another common features investigations for neurophysiology, this is nerve conduction study. This is normal because of its muscular involved. And for EMG, see the spontaneous activity in the inflammatory disorders. Now, the assessment for the DMDs, particularly for the PT management. So, name, identification for communication, age, sex, occupation, address is important. The floor, distance, and mode of transport for the patient, date of examination, referring doctor, and provisional diagnosis. This is the demographic data. Next. Now, chief complaint of the patient is difficulty in all the aerial activities, difficulty in getting up and pedaling gait, falling, running, jumping. Ask about the number of stay in hospital. Medical history to see the diabetes, blood pressure, cardiac disease, and other orthopedic dysfunction. If it's congenital, then to check the natal history. Next. Now, family history, personal history, socio-economical condition of the patient involving the financial problems or circumstances. Medication history, if patient will take the medication. Investigation, mostly genetically test. Vital signs, all body temperature, pulse rate, blood pressure, and respiratory rate are measured during assessment. Next, on observation, same body weight, ecto, endo, and mesomorphic. Next, now to see the posture in standing, sitting, and lying, to check in anterior view like symmetry of posture, position of head, shoulder symmetry, pelvis level, knee level, and ankle level, and to observe the patient. If he enter through the door, you check the gait, and to observe the way he sits in the chair. Next, another view is use of external appliances like any functional aids or catheter. Orthotics processes are if used patient to check the gait, then duration of walking cycle to check stride length, step length, time of swing. Now check in the posterior view. So he'll use lateral tilt, rotation of the pelvis, swing of trunk and arm swing. Now in lateral view to check shoulder for rotation, arm swing, spinal posture, pelvis posture, inflection or extension, knee flexion or extension, and ankle dorsiflexion and plantar flexion. These are the to check the posture. Next, types of respiration to check the breathing pattern like thoracoabdominal in female and abdominal thoracic in male. Use of accessory muscle to check involuntary movement if present, and to check the atrophic changes like texture, color, presence of scar, wound, or any pressure sore. Next, now limb length, leg length measurement is to an apparent mode, and to check the girth measurement because of wasting are present. Now to check sensory assessment, to check superficial and deep sensation. For superficial, to touch pressure by using touch, use button swab, response is yes. For pressure, to stimulus therapist's finger to give the firm pressure, and response is yes. Next, for pain, sharp pointed object is used like a safety pin, and for temperature you check by using warm water 40 to 45 degree temperature, and for cold water this is 5 to 10 degree temperature. Next, now for deep sensation is kinesthetic, proprioception, and vibrations. To check the vibration over the some bony points, the grade 2, lateral malleoli, tibial tuberosity, anterior superior left spine, ulnar sternal process, lateral coccygeal and acromion process, and clavicle. Right. Next. Also to check cortical sensation like 2-point discrimination, double simultaneous stimulation, tactile localization, synergnosis, clarognosis, graphization and recognition of texture. So all the same. Next, these are the grading for this picture. Right. Next, now motor examination, check the range of motion, both active and passive range of motion. For muscle tone examination, I check the passive movement of limb, tone is reduced or not. Now these are the grading for tone. Next. Now reflex to check all the bicep, triceps, the ankle end for plantar jerks. Next, these are the grading. Now grip strength and pinch strength to check by using dynamometer. Also speech is affected, so to check the speech. Next, for functional using some scale like functional independence measure, Barthel index, and word balance scale. Now the most important part is physiotherapy management in myopathy. So what are the main aims first to reduce neuromuscular complication, increase of muscle strength, reduce weakness, prevent deformity, improve nutrition, bowel and bladder control, and minimize the development of contraction. Reduce fatigue to educate activity of daily living, reduce or prevent the chest complication, to prolong the mobility and functions by use of wheelchair, orthosis, and to check gait training, bowel and bladder management and functional independence, and to prevent the pressure sore or wound. Next. Now, first we minimize contracture. How do we minimize contracture? By giving passive stretching for tender Achilles, serious psoas, quadriceps, and hamstring. Stretch tight muscles. So position is maintained by 30 seconds. Carefully to observe every day we go to exercise. Warm bath if pain is present. Positioning, frequent position change because to prevent the pressure sores. Then for extra fun singing and storytelling, this is more important. Always form surface such as mat should be used for the exercise, and the stretching will be used, should be done as soon as diagnosed. Next, second is to educate proper positioning and sitting by using postural correction to prevent spine and joint problem and postural correction. Second, sitting, it is important to minimize deformity, good supportive sit, walking to improve trunk control and posture. For pelvic girdle, for neutral positions without anterior or posterior pelvic any straight positions to take. Next, also good supportive sit like proper and correct support for the whole body. Chair should be whole body parts. Foot rest should be proper height, and leg of sit should support the whole thigh. Next. Now the second PT management is to educate proper positioning and sitting. That is more important because of to correct the posture, so for to prevent spine and joint problem, and for postural correction. For sitting is comfortably to minimize the deformity, good supportive sit. For walking, which is important for improved trunk control and posture. Pelvic girdle for the neutral positions without anterior or posterior pelvic tilt. Next, good supportive sit. This is proper and correct support for giving the whole body. Chair should whole body parts. Foot rest should be proper height, and length of sit should support the whole the thigh in any comfortable positions. Now third is exercise. So first endurance exercise, like first exercise in sitting. This is knee extension, is giving resisted or using sandbag. No trick movement during the knee extension. Second exercise in sideline position. This is hip abductor and extensors. 10 time is 10 to 15 minutes and then hold. Next, third exercise in prone lying position. This is hip extensor, shoulder extensor, neck and spine extensor, shoulder stabilization of scapula. Fourth, spine and neck extensors like in prone positions and to lift his head off in this position. Then another exercise is strengthening exercise for using PNF techniques and using manual strengthening exercise. Now fourth PT management is chest physiotherapy. If muscles are weak like respiratory, so use of accessory muscles in giving breathing exercise. So now first, base of lungs, some techniques are used for exercise like postural drainage. This is gravity helps to drain by different position. Second is breathing exercise, is increase air entry. Diaphragmatic and segmental breathing exercise for lateral coastal expansion, posterior basal expansion, apical expansion. FET and assisted cuffing are used. Next, fifth is optimizing functional capacity for to accessibility to room and increase fatigue, so giving rest interval during training. Next, sixth is orthosis. External appliances are used for to resist and assist movement, for transfer load from one part to another. That's why use external appliances. Night splinting are used for to prevent contracture. Necessary for ankle split should be fit properly, comfortable and lightweight. Choice depend on the severity of deformity and serial casting by increasing the range of motion. Another is facilitating a sleep. It is very important. That's why using air mattresses and good environment. Now it is gait training. First, if muscle are weak, then using parallel bar activities, then obstacle walking, and lastly is posture and gait training independently. Now family support for counseling of the patient and his relatives is another important point, and some doing recreational activities like swimming, riding and photography. So These are the PT management of myopathy. Thank you.